I'm Polly Sheridan Young. I'm a physician assistant at LMH Health. So prior to moving to Kansas, I worked for Mayo up in Minnesota in the emergency room and urgent care there. And the acute care setting's always kind of been my go-to because I never know what's going to walk through the door. I don't have a set schedule. I'm not seeing the same thing every day. And having that general practice, primary care ability, being kind of a jack of all trades and knowing a little bit about everything is kind of nice. I like it. It keeps me on my toes. And I'm always up for a good challenge as far as, you come in and you tell me your symptoms and I get to be the sleuth to figure out what's wrong. And I love coming to that conclusion of a diagnosis of like, aha, I figured it out. I definitely would say that my experiences in hospitals has been very good for me with my patient rapport because I do have an understanding, especially when parents come in with their children who are ill. I also understand as a child how scary it is to be poked and prodded by someone. So having that ability to kind of calm someone has been nice, and just being able to pull on my experiences being in hospitals has been really good. Being a parent myself, if somebody comes in with their kids and I'd be like, look, this is something I would do if this was my child, and I can tell you that because I have children. Or if I can say this is something I would do for myself or my spouse, I kind of draw on those personal experiences to kind of make it more personal to the patient. So good or bad, I kind of have a direct approach. I don't tend to sugarcoat things too much. I think with some patient populations, when you aren't direct, they misconstrue what you've said and maybe are like, well, it wasn't that big of a deal, when maybe, yes, your blood pressure of 190 over 100 is not okay, and we need to really talk about the fact that you could probably make some lifestyle changes and what those lifestyle changes actually are, as opposed to just saying lifestyle changes. So I think my philosophy is to be very direct with patients, give them a better understanding and do that education background, because you get a lot of patients that come in and want an antibiotic for maybe their cold that's viral, and explaining and taking the time to explain to the patient, hey, that's not appropriate, it's not going to help you, it's really not going to help your symptoms, and it could actually do you more harm than good. So I do like to take that time of educating the patient and why and how this is going to work and what the medication that I'm going to give you is going to do for your symptoms as opposed to not. I didn't grow up in Lawrence, but I'm a native of the Kansas City area, and I really do love Lawrence as far as the community that revolves around it, and it's nice to have a hospital system here in town to pull off of. So it's nice to have all those resources, and it's good to have kind of the hospital system in town versus having to travel hours to get to a main hospital so that you can see a specialist, and having that integrated group of people that you can reach out to.